Hello, I'm Ruth Sedgewick. I'm head of the Northern Ireland office for RCSLT. And here in Northern Ireland, we have a small team of three. So myself, and then Vivian, our policy advisor, and Janet, our executive assistant. And we love working together, but we love working with our members because that's what we do. We work for you and with you. Sounds really, really cheesy, but it's true. And our aim is to raise awareness of the role of speech and language therapy and what speech and language therapists can do, but also to raise awareness of those living with speech language communication needs and swallowing issues, and highlighting what they need in Northern Ireland as well. So one of the things that we offer is we send out a monthly newsletter. And this is really to keep you up to date with current projects, any policy changes or strategies we're involved with responding to, and we may ask for your input. And I was thinking about this, I thought it would be good to mention my work. So when I worked in mental health prior to taking on this role, I was involved with RCSLT Northern Ireland with Vivian and my predecessor in responding to the mental health strategy consultation. So myself and some other members helped Vivian really shape the response to make sure it was meaningful and relevant to us working on the ground. And it was really successful. We achieved recognition in the published strategy. The link between communication and mental health was mentioned. It's there in black and white. And from that, we were then invited to sit around the table for the workforce planning in the Department of Health, and have been able to advocate for the need for more speech and language therapists in CAMHS and mental health and adult services going forward. So it's a really good way, an interesting way of helping shape the future of the profession. So I would really encourage you to consider getting involved, whether that be in workshops, webinars, or some of the working groups that we may send you links to, and that'll all be as part of the monthly newsletter. I also wanted to mention our Northern Ireland Hub. So the Hub is a selection. We've got about 13-ish speech and language therapists. We've got retired members, student members, members that work privately, and from all the different trusts. Some of you will know about this because we do have, as I said, student members. But the Hub are there to give us information and support and advice in terms of what's happening on the ground, and really set our objectives as to what they need from us and how we can support you all working on the ground and have a real say in the direction of the work that we take. For example, our Northern Ireland Assembly elections that happened earlier this year, the Hub supported us and were really, really influential in writing and setting our 3 manifesto asks. And those asks were about a communication inclusive Northern Ireland, advocating the use of CA UK, the training package, workforce, and the need for more of a workforce because we're so small. And then thirdly, it was about equality for children's services and access to services for all children, whether you're in mainstream school or special school, etc. So the Hub was brilliant with that. This year, they've also helped us plan and organise our leadership conference, where we have 150 members getting together in the Titanic conference. So if this sounds like something you would like to get involved with, please do get in touch and let me know. In terms of regional recruitment, I should say, we still use the regional method for NQPs, and this means there's only one interview only. My advice to you would be take all the practice you can get. Ask each other for practice sessions, ask your family to help, but I get it, if that's not your thing, it was never mine. I never practiced with anybody else. Say your answers out loud. That is literally what I would do. I would speak them out loud and pretending that I was in the interview. Interviews are not the time to be humble. You need to build yourself up, speak about all your accomplishments and strengths, however small they may seem to you. And this is not only about placement, the placements that you've been on. You may have had jobs before this, part-time jobs, family commitments, other things that you have done. Speak about those because they also show your strength. And yeah, absolutely, say it all. And in terms of a job offer, I would say seriously consider any offers that come your way, even if it's not your number one pick or your geographical area. It's a really good foot in the door. Once you've got your job, it's usually easier then to get another job. My first job, for example, was in Peds in Ballymena, which wasn't an area that I wanted to be in. And certainly I was living in Dunmurry, so the location wasn't handy either. But it gave me that good start, a bit of confidence, and I was able to then get a job with adults closer to home about 6 months later. So in terms of registering, you need to be registered with the HCPC, which you will have already heard. And here in Northern Ireland, the NHS employers will also ask that you have membership to us, to RCSLT, which obviously I think is great. But, you know, it really does give you so much in terms of access to help, resources, the latest guidance and evidence base, and lots more. What I would just want to finish by saying is please feel free to contact me, Janet, or Vivian at any stage. We are always happy to chat with our members to see if there's any way that we can help you, or to just call into our Belfast office for a coffee someday. It would be lovely to meet you, and good luck in your interviews and your SLT journey. Thank you.